6 minutes after 7, good evening and welcome along to the News Hour on this Wednesday night. Andrew Reimer with you up until 8 o'clock and I'll be taking your calls on 8223 0000. You can SMS 1999 1395. The emails are out of action at the moment, according to our technicians, so phone, SMS is pretty much the best way to get in contact with us and being part of the program this evening here on Adelaide's FiveAA. Now, before we start the program, I just want to let you know we're doing something a little bit different tonight. We are covering news stories, but what we're also doing is having a couple of guests in the studio with me tonight to talk about the issue of abortion. I've got Independent MP and the member of the Legislative Council, Anne Bressington, in the studio, and also Dr. Tony Turnbull. Dr. Turnbull is a general practitioner who's worked for family planning in the past and has quite a bit of information on her experiences to do with family planning and what goes on out there in the community. Now, before we speak to the doctor and also Anne Bressington, I do want to warn you that if you're listening at the moment, that the subject matter we're about to talk about could cause distress to anybody who's gone through the process of having a determination. Now, having said this, I do, encourage you, if you can, to stay listening, because I believe the issue of abortion is a topic that should not only be discussed, but considering the process of terminating a baby is also a medical procedure, it should also be debated by all parties, whether they be for or against, so that those who are considering the procedure can make an informed decision because they are armed with all the facts. So if you'd like to be a part of the conversation over the course of the next hour in regards to this issue, feel free to call on 8223 0000. Anne Bressington and Dr. Turnbull, thank you very much for coming into the studio tonight to talk about this issue. Now, before we take go the course that we're going, I'm wondering, Dr. Turnbull, can you give us a bit of a picture as to how many terminations are performed here in South Australia on an annual basis and the reasons why women have abortions?
It's around 5,000 every year. Over 5,000 every year. Originally, the legislation was passed for the hard cases. But if you look at the breakdown, 98% are performed for so-called psychiatric reasons, which we all know are social, and 2% are for abnormality of the child, possible abnormality of the child, and for mental illness of the mother. So that's 98% for psychiatric reasons and 2% for all the other reasons. Okay, now, the psychiatric reasons, can you elaborate on that, please, if possible? Well, psychiatric reasons means I would be stressed if I had this child. I can't fit it in, I'm studying. I can't afford to have a child. They're not psychiatric reasons. We all know that they're not psychiatric reasons. There's social reasons, really. But they're given as psychiatric reasons in order to justify the procedure? Under the Act, yes. Yeah. Okay. Now, just a moment ago, I mentioned in my opening comments that it's important for women, and I would have thought couples as well, to be armed with as much information as possible to make excuse me, an informed decision. Are women and couples given all the facts when seeking out the information they need in order to get an abortion or a termination, however way you wish to describe it? Oh, that's a difficult question to answer because I don't know what everyone else does, and I believe I believe that most women don't, in their heart of hearts, really want to have an abortion. I believe that most women have abortions because they feel they haven't got a choice, which is sad because we're told this is about choice. Most women who have abortions feel that they have to have an abortion for different reasons, and often because they're pressured into that situation by their parents or by their partner or by their circumstance. But I don't know. I have seen people come out of pregnancy advisory clinic who have been down there, who've been sent away and said, go and make up your mind. I think in South Australia we're a little bit lucky. I don't know. We have a different situation. We don't have freestanding abortion clinics that are only paid if they perform an abortion, where in the eastern states that's the case. Unless an abortion occurs, no one gets paid. Whereas in our abortion clinic here in Noarlunga and Pregnancy Advisory Clinic, they're paid by the hour, whether they do abortions or not. So the pressure is not the same. And I think that's why our abortion rate is actually quite low compared to the eastern states.
Mm-hmm. But there are some people calling for us to come into line with what's going on in the eastern states, I understand.
Freestanding abortion clinics.
Yeah.
Well, we will have a lot more abortions if that's the case, because the technique, I mean, we've had several visitors from the States who've been running freestanding abortion clinics and have come out for different reasons and then have been able to say, well, this is what happens and this is how we persuade everyone to have abortions, because we don't get paid and we need a certain number and we have to increase that number all the time in order to make a very good profit, because it's about money once you start having a freestanding abortion clinic.
So essentially what you're saying, it's pretty much an industry over in the eastern states.
Well, it certainly is in America.
Mm-hmm.
I would think the model is very similar. The people that we've spoken to are people who've run abortion clinics in the States with a freestanding abortion clinic. I haven't really spoken to anyone from the eastern states, so I can't be 100% sure, but it's a similar arrangement. You don't get paid, the receptionist, and nothing gets paid unless someone has an abortion. And so it's an abortion industry, and the money has to come in.
Okay. Now, that's Dr. Turnbull, who is a GP and also worked for family planning, on the News Hour with myself tonight. Just want to let you know, I don't have a producer. If you're phoning the program right now, I'm putting you on hold. I'll take your calls during the break and get your details and get you on air as soon as possible, so you can either ask a question or make a comment in relation to this issue. And Bressington MLC is also in the studio with me at the moment. And the last time we spoke on the program, you came under a lot of fire over your pamphlet, Life Matters, or Doesn't It? Now, in this pamphlet, you described in what would a lot of people would say horrific detail the procedure of terminating the fetus or unborn baby.
Yeah.
Now, Shite SA, they stated that the pamphlet contained inaccurate information that could traumatise children as well as women who had undergone the procedure, and that terminations of pregnancies don't occur in the way that has been graphically described in that pamphlet. So you still stand by what you have placed in that pamphlet?
Absolutely, I do.
Okay.
And as I said in the beginning, this pamphlet was put together with information provided to me by gynecologists, obstetricians, people who have been involved in the area of abortion, people who have been trained in at the Pregnancy Advisory Council of South Australia, and also women who had had abortions and women who had gone in to consult about having an abortion. So I believe I got a pretty broad base information into this. It was also taken out of articles that had been written, papers that had been written, documents that had been published. So I didn't just make it up. And let me just say that of all of the emails that I got about the misinformation and misrepresentation, the most serious allegation was that I used the term unborn baby instead of fetus. So if that's the worst I've done in providing information, then I haven't done too badly. But you see warnings on cigarette packets that say smoking will be harmful to your unborn baby, not your fetus, to your unborn baby. We see ads on television for Elevate saying that, you know, before you even know you're pregnant, a little person is already forming. So it seems to me that when a pregnancy is wanted, we refer to it as or planned. A baby is referred to as an unborn baby. When it's supposedly unwanted or unplanned, then we dehumanise it and refer it to it as a fetus. I think myself that's splitting hairs.
I must add here that fetus really is Latin for unborn baby. So you're actually perfectly correct to say it's an unborn child.
Dr. Turnbull, just a moment ago you talked about the fact that the difference between South Australia, the abortion rate here compared to the eastern states, is the fact that we don't have the freestanding clinics. There's not that same incentive that may be on a clinic to get people to go through with the termination. Having said that, though, now, Anne, you state that women have been coerced into abortions here and they are getting all the facts. So where's the incentive for abortion clinics here in South Australia to coerce people in it if it isn't, the monetary pressures aren't there?
Well, I think this on your show last time I said I don't understand why that's happening, but we are actually transporting people now or referring people now over the border to Victoria for full-term abortions and for late abortions. And as I used that example last time about the 26-week gestation, baby was diagnosed with a preliminary test for Down syndrome. The woman was booked in. That happened on the Friday, and she was booked in to be in Victoria the following Wednesday for a late-term abortion. Before the in-depth tests that are needed to truly diagnose Down syndrome had been done, she got cold feet about the abortion and had the proper testing done, and it came back that those tests were negative. So it's about, I guess, giving people space and time to think about that, about doing those tests thoroughly and making sure as you can, that the information that you're giving the mum is accurate. And how would a woman feel if she went over, had an abortion at 26 weeks because she believed that baby was Down syndrome, and then found out that she'd aborted a perfectly healthy baby and it was a planned pregnancy? So it's about being careful and being thoughtful and understanding too, Andrew. I believe that there are some women out there who could have an abortion and walk away from it. And, fine. That's what they do. But I also know from my previous life that there are many, many women who never recover because they're not prepared for the psychological and the emotional upset, the grief, the loss, that for them is going to be very real. So it's about being careful about the information that we're giving mothers, about where we're referring them to, and about also looking at them as an individual and how we would best support them through a pregnancy and the information that they're getting to make sure that it is truly in the woman's best interests, because that's what this pro-choice, pro-abortion lobby is supposed to be about, the best interests of the women. Yet I've seen so many broken women, and I know that Dr. Turnbull and others have as well.
Dr. Turnbull and Bressington, it's 90 minutes after 7. We'll take some calls. We'll come back in just a moment. The number to ring is 8223 0000. If you've got a question for either Anne or Dr. Turnbull, feel free to ring or SMS 1999 1395. 22 minutes after 7, you're listening to the News Hour. Andrew Reimer with you till 8 o'clock. Phil Sheldon in with Bob Francis talking health, natural health, right after the news at 8. My number's 8223 0000. SMS 1999 1395. Emails are out at the moment, so if you'd like to make a comment, either phone or SMS, and it's greatly appreciated. My guest in the studio this hour, Anne Bressington, MLC, and also Dr. Tony Turnbull, a GP. Robin's on the line, and you've got a question, or you wish to make a comment, Robin?
Actually, it's question and comment. So I'll start off by saying I attended an information session at the Pregnancy Advisory Centre, and everything I'm going to say here was talked about on the day and provided to us on DIS form. So what I'm saying is actual facts. During our day of training, so the Pregnancy Advisory Centre does more than 50% of South Australian abortions. Now, out of that, only 10 to 15% of the clients are counselled. Now, this is really concerning. Women are not offered counselling at all unless they ask for it. Now, out of that, the counselling that they actually receive, and this is a statement from the actual DISC itself that they provided to us as professional workers, initial stage of counselling, and then the statement says, state pro-choice decision. All women are seen alone initially by a nurse or social worker. No husband or partner are permitted. After clarifying the decision, women may choose to have their support person sit in. When speaking to these women, You never mention the word mother and baby because this is too emotive. They use what's called women-centred language. Now, this is in quote, all right? This is exactly off the disc. Ensure your language does not reflect the assumption that the woman will continue the pregnancy. Their terminology is stated that this is what each woman must be, each client is told. They must never use the word mother, they use the word woman. Sexual partner or man involved instead of father. Pregnancy or fetus instead of the word baby or child. And regarding the procedure itself, contents of the uterus, medical cremation. My concern is if they are supposed to be the Pregnancy Advisory Centre, they are not giving proper advice to women. They are there announcing a pro-choice decision for these women to take. All counselling should be independent from any abortion facility for that reason. So what does Dr. Tony think of that?
Thanks very much for that, Robin. And Dr. Turnbull, what are your thoughts? I heard you... yes.
Well, I'm not in everyone's room, so I can't see what they do. But certainly, I certainly remember now. You're quite right, Robin. You actually have to ask for counselling, and if people don't ask, they don't get it, and they can make very bad decisions. So that is the first problem. And the counselling, I have actually heard from women, and I've asked them what has happened. The counselling is often about birth control. It's got very little to do about their situation, although quite often it is. But I just wonder, I don't understand why. I guess it's political correctness or something. I don't understand why they are pushing women into having abortions, really, because they don't have to. Equally, the women's and children's do a fair number of abortions, so do Noarlunga, places like that.
You mentioned just a moment ago, Dr. Turnbull, the word family planning, but and I'm trying to think of the exact word. Sorry, there's a few other things happening behind the scenes as far as answering the phones is concerned, because I don't have a producer. But there are some people out there in the community who believe that abortion is a form of contraception. Do you understand what I'm saying?
Yes. Well, certainly. I think I can remember there was Flinders Medical Centre had a session on an afternoon on abortion, and they were saying it would be normal for a woman to have 7 or 8 abortions in her lifetime, and that would be the foreseeable future. From a medical point of view, that's disastrous.
So it can be seen as a form of contraception, yeah.
It's not by the medical profession, but it is by people themselves, yeah.
There's an attitude out there by the sounds of it. Dr. Rob is on the line, has phoned into the program. Hello, Dr. Rob, and thanks for holding on.
Hi.
You'd like to make a comment?
Really just wanting to support Anne Bressington with relation to her pamphlet being factually correct. The methods she describes are in use for abortions from 13 weeks onwards, and I believe her pamphlet is factually correct.
Doctor, can I just, you call yourself Dr. Rob, what's your background?
Yeah, I'm a paediatrician. I've worked in teaching maternity hospitals like the Women's and Children's for over 30 years. So I look after newborn babies. I listen to women telling me stories of previous pregnancies, including terminations, and sometimes when I tell them their current baby's perfectly well and healthy, they burst into tears, and out comes the story of their grief and depression from the termination of a previous pregnancy.
Mm-hmm. And the reason for that grief that you're talking about?
In a sense, I mean, I speak as a mere male, but in a sense, terminating a pregnancy is a very unnatural thing for a woman to do. I think from the time a woman knows she's pregnant, she feels like a mother, and many of them are bullied into having a pregnancy by their partner, by an employer, by family, and it's not a free choice.
Excuse me, Dr. Rob, we're talking about the year 2011. We're not talking about 1940 or 1950 or something along those sort of lines. I would have thought that social attitudes towards what you're talking about now have changed considerably.
From my point of view, they've not changed enough. Women are still being coerced into having abortions that deep in their own heart they do not wish to have.
All right, Dr. Rob. Well, thank you very much for your comments. It is 29 minutes to 8 here on Adelaide's FiveAA. 8223 0000 is the interactive number. If you've got some thoughts, some comments to make, give us a ring. SMS 1999 1395. 27 minutes to 8 on Adelaide's FiveAA, 1395 AM. You can phone on 8223 0000 or SMS 1999 1395. My guest in the studio, Anne Bressington, Independent MP and also MLC, and Dr. Tony Turnbull, who's a GP and formerly worked in a family planning clinic. And we'll continue to take calls. I've got Peter on the line. Peter, thanks for waiting.
Thank you very much. My concern is about the information on the Pregnancy Advisory Centre site. One part says here, a consistent opinion has emerged within the medical profession, and extensive searches of health and social science databases reveals that psychological effects of abortion are benign or positive, and that serious adverse effects are rare. And that flies in the face of the most recent review of 22 studies that had been done, and it's done by a Dr. Coleman. And in that, she reviewed the studies, 22 of them, and had combined participants total of 850,000. And the results show that there was an increased risk for anxiety disorders, 34%, depression, 37%, alcohol use, 110%, marijuana use, 220%, suicide behaviours, 155%. Now, a lot of their sites that they direct you to are very heavily pro-choice, and this is where I agree with your former caller who said we should get independent advice instead of some of this biased information. And also got a thought, too, around the fact that it doesn't need to be motivated by money, but it can be motivated by an ideological drive that says that women should comply with their way of seeing life. And that's a concern for me, because suddenly when you're looking at the after effects of abortion, in their advisory area, how women cope after an abortion, there's really information there that becomes advice. It says, for sadness, sometimes people think they are experiencing guilt or regret when actually they are feeling sad. Try to explore what you are feeling sad about so it isn't just a vague feeling. When you are specific, you can do more about it. It is important for you to trust in yourself in regard to making a decision to have an abortion. My concern is that when they try to trust in themselves and find that lacking, that's when the mental health issues come in. And I'd just like to hear the comment from either Anne or Tony.
Thanks very much for that, Peter. And you got from the Pregnancy Advisory Board's website?
Yes, I've gone for that, and I've got the reference for the latest one from the British Journal of Psychology, British Journal of Psychology, and I've got that here. And it shows very, very clearly that the APA that supported some of this material, first off, that was used by Planned Parenthood, actually has taken it off their site since this has come public. But the Planned Parenthood site has not taken it off. They're still using that misinformation. And I'm concerned that they're not giving a true evidence-based material for people to make an informed choice.
Peter, thanks for your comments, mate. Thanks
you
very much. It is 24 minutes to 8. Dr. Turnbull or Anne, what are your thoughts about what Peter just talked about?
I'm at the coalface, and I'm not a researcher. I'm a general practitioner, and I see all the time bad results as a result of abortion from a psychological point of view. And I think women are sometimes really surprised at their response. I did in the 90s, was it something like that? I was confused about whether in fact there was, and I was just seeing the people who were in trouble. So I did a little project, a pilot study of my own, and for the next 13 patients that I saw with termination of pregnancy written on their case notes, I said, now your consultation is finished. Do you mind in my time, meaning they don't have to pay for it, would you be prepared to talk about your abortion experience? And I saw 13 people, women, all of them really wanted to talk about it. Now that first of all surprised me. I would have thought a few would say, nothing, no, I haven't got the time. But all of them wanted to, and all of them were quite affected by their abortion in many different ways. Nightmares, unable to hold babies, and difficult relationship with their others. There was one person, and the only person in that group of 13, who said, no, I have had no effect at all, but the woman that was in the bed next to me screamed and kept screaming after her abortion. And I asked her about her life, and in fact she was probably the one who's most affected, but was living in denial, in that she had previously had heterosexual relationships, had then subsequently had homosexual relationships only, and couldn't look at children and couldn't work with children, whereas previously that had been her job. So I thought, really, I mean, looking at them all, she was very severely affected. So, yeah, I can't see how anyone can say people are not affected by abortion.
Would you have statistics as far as the median age of women who seek terminations? How old would they be?
It's through the full.
The median age of the women themselves, the mother of the child.
The median
age of how old would they be? Say between age 15 or 16 up to age 50.
It's all the reproductive age.
Yes.
All of those women are having abortions.
Yeah.
But the major numbers, surprisingly, in the 20s to 30 group. And I was surprised when I saw that's the major group.
Why? Why are you surprised?
Because I think between 20 and 30, I would have expected those women to be knowing how to use their birth control, have sorted their lives out a bit more, whereas a teenager, you'd expect, would have many more surprise pregnancies. And then the older ones who are thinking, I can't cope with another baby, there's a 10-year gap.
Yeah.
They're the groups that I would have expected to be higher, but it's not so. It's the 20 to 30s.
Now, you touched earlier on about the 98% of psychiatric reasons. Are we able to delve into, are we able to get some sort of indication as to, when you're talking about those sort of age groups, and we talk about the psychiatric reasons, and that's a very broad spectrum when you talk about psychiatric reasons, but the in particular reasons why they chose to terminate those babies? Was it because of was it to do with career? Was it to do with
often career, often study?
Okay.
And often, or sometimes parents are making me do that, or it's interesting, sometimes the partner says, I'll leave you if you don't have an abortion. And sadly, most relationships break up as a result of abortion anyway.
Okay. We've got another call, Naomi. Hi, Naomi. Thanks for waiting on.
That's okay. Thank you, Andrew. Good evening, Dr. Turnbull and Anne. And I'd like to say thank you for organising the brochures on adoption and passing them out. I know you've copped a lot of criticism, but the facts that are on that pamphlet are much appreciated, and I think it's important that we are educating people out there in society. I personally know of 5 people that have had abortions from various ages as early as 16 up to the age of 47, and all of those are now suffering drug and alcohol issues, depression issues, anxiety issues, and serious mental health issues. And myself personally, I've been helping a friend down at the abortion clinic, trying to help women and offer them an alternative. I'm not affiliated with any organisation, but just offering them, would they like some help and support with their pregnancy and keeping their baby? And they're just overwhelmed and surprised by the fact that someone wants to help them. And it's sad that when they go into the advisory clinic, unless they ask for counselling, they're not given it. I just think it's just so crucial that they are told about the fact that what they are carrying is a human life and the importance of repopulating the society. Otherwise, eventually, if everybody keeps having abortions and the family unit's not valued and life's not valued, where is society heading?
Yeah, well, Naomi, I agree. I've seen so much of this when I was in drug and alcohol for 13 years. And I would see women coming in with serious drug and alcohol problems, and it would be 6, 7, 8 months down the track in their recovery that they would then start to recall the abortion and go through the emotional trauma that they should have gone through when they had the baby. So the grief, the loss, the sadness, as one of the other doctors mentioned, but all of that was postponed because they started taking drugs and alcohol to mask those feelings because they didn't want to feel what they were feeling.
That's right, yeah.
Now, I know that people are going to say that, this is part of a Christian right-wing lobby group that I've got caught up with and that's why I'm pursuing this.
Is it?
No, absolutely not. I have seen, as I said, for 13 years, probably 60% of the females that accessed our drug and alcohol clinic had abortions. And for them to compare their recovery to young girls, to women who had not had abortion, their recoveries were quite different and took much, much longer. And some of them have required anything up to 5 years of ongoing support to get them past what they deem to be guilt, shame, grief, loss, and to work through those emotional processes that we all go through when we lose someone or something. But that never happened for them.
Yeah.
So this issue for me, long before politics, was a major issue for me. And for women to be treated with the respect that they deserve if they have this procedure, for it to be acknowledged that it is human.
Yes.
It is okay to feel not right after you have this and not to have to just get up, brush yourself off and move on with life.
Yeah, and
there is a grief process.
When the women do go in and they take the tablets with the procedure that they're given, they're not told about what's going to happen to them. They're sent home, and these poor women are going through an induced labour on their own, in their own home, not knowing what to expect. So, not to mention the pain associated with a premature labour, but they're alone and they're frightened and they don't know what's happening. And I heard you talking earlier this evening about having the scans, and with the Down syndrome, myself personally, I had a scan at 19 weeks with my daughter, and this was at the Ashford Private Hospital as a private patient. And she said to me, "You've got a less than 3% chance of your daughter having," we didn't know she was a girl at the time, "of having Down syndrome. Do you want to keep it?" And what do you mean, do I want to keep it? Look at it. She was fully formed, and we had her, and there's nothing wrong with her. She's absolutely perfect.
Yep.
And some people may well have gone ahead with it, and I know people do, because those scans can be wrong.
And it's all how the question is framed and the information is
given.
given.
Do I want to keep it as if it wasn't even a human being? And also I looked into that only less than 70 adoptions were in Australia last year. Why don't we have a waiting list for people who can't have children that can put their names down? And obviously there would need to be procedures and policies in place, having screening, etc. But why are there not enough adoptions?
Naomi, that's a very good point. I do have to leave you there. Thank you very much for your call and your comments. I appreciate it very much. And would you like to comment about the adoption side of things at all, either Dr. Turnbull or Anne Bressington?
I think Anne Bressington was telling me about a recent bill that didn't come up at all. It was from Family First.
It was voted on, it was defeated, and it was... The only requirement was that when women went into the Pregnancy Advisory Council to get information on abortion or consultation, that they were given a information pamphlet on abortion as an option, on adoption as an option. And I've got to say that the debate that ensued in the Legislative Council was horrifying. This is the beginning of a downwards, what do they call it, slippery slope, where we'll be banning abortions, and it was taken completely out of context. And I know of one person in the council who said to me at the very beginning that she was going to support that bill because she saw it as non-challenging to abortion. Mm-hmm. But when it came time to go to the vote, she voted against it because of the pressure that she'd been put under by what she termed as the feminist movement.
Okay, and it's 30 minutes. Sorry, Doctor.
And all that really was giving a woman information about adoption. How can that be bad?
Okay. Now we've got Grant on the mobile. Has been waiting a while. Thank you very much, Grant.
How are you, Andrew?
Good, thank you, Grant. What was your comment?
Andrew, thanks for taking my call, and to the doctor and the other lady in the studio as well. Andrew, I'm actually, this is a topic which actually gets my back up completely, mate. I actually fully don't believe in abortions at all. The only time an abortion should happen is if the unborn is going to be mentally or physically challenged, or if the female is raped. Because it's just easy to zip down to the hospital, get an abortion, 6 months later, and you do it all again. Everyone knows what happens when you have intercourse. There's too much protection out there. So I just can't believe that there's people out there which should not say happen to have it every day, but don't mind other people from having abortions, if you know what I mean.
Mm-hmm. Okay.
And that gets my back up all the time. It's a human being. Just because you want to play around, the unborn child has to suffer an abortion. That's not right.
Okay, Grant, thanks for your comments. Good to
Thanks,
talk to you.
Andrew.
Okay.
Bye.
It's 12 minutes away from 8. I'll be back with more in just a moment. I've got a lot of questions, or I have a lot of questions, but we've also got calls for Anne Bressington and Dr. Tony Turnbull, so we'll take your calls in just a moment. Wait on there, and just a reminder, if you're calling into the news hour, I don't have a producer, so I've got to wait till the commercial breaks in order to be able to take your call, but as soon as I do get to you, I'll get your details and get you on air as soon as possible. You can speak to the doctor or Anne. 7 minutes away from 8. We've got 3 calls to get through in order to speak to Dr. Turnbull and also Anne Bressington before we get to 8 o'clock, and news with Marcus, followed by Bob Francis, Phil Sheldon in the studio as well, to take your calls over the next hour. Joseph, you've been waiting quite a while, and I appreciate that very much. Joseph.
Thank you.
You'd like to make a comment?
I would indeed, actually. There's 3 quick comments. The attitude towards children, I was interested to hear Dr. Turnbull talking about, women having 7 abortions of, birth control. We've got 7 children. So we are putting our money where our mouth is. I'm also totally blind. And so I was interested to hear about the previous person who was talking about having an abortion for someone with a disability. And my mother was told to have an abortion, and she refused. But the whole attitude towards children in our community is incredible. We can go for a walk around our block, and every single house has multiple dogs, but hardly any houses have children. And there's this terrible attitude towards children. But interestingly, you can abort your children, but if a mother wants to have a home birth, wanting the best for her child, the hospital and the police are waiting at the door as if she's a criminal. And my final comment is to do with the fact that whether you call it homicide, whether you call it abortion, or whether you call it euthanasia, we are not at liberty to make laws against moral law. No one would ever dream of making cold-blooded murder legal. So why is it that abortion is legal?
Joseph, thank you very much for your comments. Greatly appreciated. William, hello, William. It's 6 minutes away from 8. You've got a comment to make as well?
Yes, look, I'm a GP in Adelaide, and I've been researching into determination practices within South Australia, and I was just listening to one of the earlier callers, and I just for the number of abortions that happened, I'm looking at the 2008 figures, there was a total of 5,101 in South Australia. Of them, 4,927 were for the mental health of the woman. However, only 2 of those 4,927 had a pre-existing psychiatric disorder, something like schizophrenia. And so the comment I think Tony Turnbull made earlier was that a number of the women, or the majority, have an abortion because this doesn't suit me, or this, I want a career, or this isn't the right time, or I don't think I'm going to be a good mother. That is basically the majority of the reasons. And that actually slips under the banner of mental health, whereas most people's perception would be that, the person's, becoming psychotic, or they're actually losing their sanity, or they may have a serious medical condition where their life is absolutely threatened. But the majority of these abortions are more to do with convenience.
All right, William.
That's what the figures actually show.
Thank you very much for that insight. We do have to leave you there because unfortunately we are running out of time, but I appreciate you taking the time to call the program with that information. And Ros, final call. Hello, Ros.
Hi. Thanks, Andrew.
That's all right.
An earlier caller talked about adoption and said so few babies are available these days, and that's true. Only 2 babies were released for adoption in South Australia last year. I was at a hearing of a Senate inquiry into forced adoptions. You know that years ago, some women, if they were unmarried, were put under great pressure to give up their babies for adoption, and they're now suffering great grief. And it seemed to me that a lot of the grief symptoms these women are suffering are very similar to what women are going through today when they've been pressured to have an abortion. And I would love to see an inquiry into that problem, grief following abortion. Also, many of the people giving evidence to the Senate inquiry talked about all the terrible depression and so on they'd gone through and said adoption should be made illegal. And I think this is behind the reason why so few babies are released for adoption. The social workers today believe adoption is very bad, and in no circumstance will they recommend it. So I was wondering whether Anne or Tony had some comments on that.
Well, Ros, you've given us a lot to think about and comment on, but unfortunately we have run out of time. That's definitely against us, but thank you very much for your call, Ros. And Dr. Turnbull, thank you very much for coming in. We sadly have run out of time. I mean, this is an issue that could go on for a few hours at the very least as well. Perhaps we can do it when I'm doing an overnight program if you're prepared to come in. And
yes, the post-abortion grief one would be good.
Yeah, okay. Well, we can follow that up again. Yeah. Look, thank you for coming in. If people want to find out more about this issue, get better informed, contact your office. What are some of the other agencies out there where people can access information?
Tony, that's yours.
Birthline, Genesis Pregnancy Support, their phone lines, and they give information.
Birthline and Genesis Support. Okay. Well, thank you very much again, Dr. Anne Bressington.